opportunity, while I have you here, to raise a number of other issues. Firstly, I want to talk about the issue of arthritis for children, which is in a very bad situation in Ireland in terms of the services that are being made available to them. There are approximately, precisely, I gather, 2.5 full-time equivalent rheumatologists in Ireland. That's the second worst in the EU, and there should be between 5 and 6 for a population of our size versus the prevalence of the disease. The World Health Organization recommends waiting times for children of no more than 6 weeks. The current waiting time for a child in Ireland at the moment with arthritis is a staggering 2 years and 4 months. What we have is essential appointments for children being cancelled regularly. This is due to the consultant paediatric rheumatologist being called for on-call emergency treatments in Crumlin Hospital. And because of these essential appointments being cancelled, we have many children on what are in effect very, very dangerous drugs, and they're not being reviewed with the frequency that is required to give them the optimum care and treatment plan that is needed. So in essence, Minister, what's needed here is an increase in the number of paediatricians, and in particular an increase in the number of rheumatologists here in Ireland. What's also needed, when you consider that it's only Dublin that this is provided for, if for arthritis and things, we have Manor to Hamilton is a centre for this in North County Leitrim. But that's only an adult service, so children can't go in there. Really what is required is a locum or regional locum clinic for this, with the appropriate paediatric rheumatologists to visit there, so that children don't have long journeys and don't have the kind of long waits. As I said, the WHO aimed for 6 weeks and recommends 6 weeks, whereas we here in Ireland are currently delivering a very poor service at 2 years and 4 months, which clearly, if one has to wait that long and suffering from such an acute illness like that, children could be irreparably damaged as they are growing. Obviously, they need ongoing care of a specialist nature, and we're failing children in this country at this moment in time. And another issue that I want to raise is it's the whole issue of home help hours, which I know in all of our constituencies has become an issue. We all know the cupboard is bare in terms of resources, but it's about the management of what we are doing. Older person services, as we know, is covered under the social care division, which is a division within the community care area. Under the national lead, and perhaps you'll be able to find out the name of this individual, it is understood by me, and anecdotal evidence certainly confirms, that they are directing nationally that all home help hours are to be reduced and not to go over a certain amount, regardless of the level of needs or dependency, that this is the case. And I would ask you, Ministers, to look into this on a national basis, because anecdotally this is what is coming back from the social care professionals throughout the country. In addition, many people who are in homes, who want to be cared for in their homes and are surviving quite well there with the appropriate level of home help hours. The new directive that seems to be coming down from the lead person in older person services, which is under the lead person of social care, the reductions will mean these people will not be able to cope. That in turn will put more pressure on the nursing homes throughout the country, and as we know, there are a shortage of nursing home beds with an ageing population, and in turn that will put even more pressure on our acute services. Moving on from that then, what we have in terms of the winter initiative is in effect the discharging patients from hospitals are receiving priority over those that are already existing and receiving home help in their homes. And that's going to put further pressures on that. And there shouldn't be a prioritisation of that at the expense of people who are already being cared for in their community. And I don't want to be just seen as moaning without at least suggesting some solutions. And one that as a member of the Senate, and indeed earlier in this term here in the Dáil, that I've suggested that costings be done on the abolition of or at least the partial abolition of the means test on the carer's allowance. Because to my mind, we all have a relative, a sister, a brother, an aunt, an uncle, a father, a mother, a grandmother, who one of the family would be more than capable of caring for in their home, with the benefit of the carer's allowance, whereby they could keep them in their home. In addition, we could ensure that person had a medical card. Even to add further to that, if there are home adoption grants that are required for that purpose, we'd still be talking about a fraction of the cost when one considers that the average weekly cost of a nursing home is between $800 per week or $1,600 per week, depending on what part of the country and whether they're public and private, which is a colossal amount of money. Go further, the cost of an acute bed per day is in the region of €1,000 per day. So it certainly justifies that we would do a costing on this and be prepared to push the boat out and say, look, is there a better way to keep people in their homes? Clearly that's where they would like to remain, and if there are family members in a position to care and do that, then why don't we at least examine the potential to give these people the carer's allowance and some additional supports, which to my mind a cursory glance would suggest that the amount of money that could be saved, not least the pressure that would be taken off what is a very short number of nursing home beds, and we all know from listening to Fergal Hickey, who's the spokesperson for the emergency medicine practitioners in Ireland, the difficulty that we're having in terms of bed numbers at acute hospitals, where he suggests, for example, that 300 people are dying every year because we don't have enough beds made available for people on the acute side. So I would ask you to also take that on board. My colleague mentioned the drug Orkambi, and I cannot stress the importance of making this drug available to people throughout the country who are suitable to be treated with the drug. It is a total game changer, and by changing that game, we can equally reduce the burden on the state in terms of caring for these people when they become more ill without the benefit of Orkambi. Every constituency has seen young people pass away, my own constituency in particular. The very courageous Gráinne Golden and her family, Ashley and her sister and mother Terry, have been exemplary in promoting the need to make this available. And I think with John Crown in the other House, for cancer drugs in particular, we brought forward a suggestion at the time that drugs, rather than us being in a position to have to fight through the Joe Duffy show and other means to get access to certain life-saving treatments, it should be a case that governments opt out of the provision of a drug if the cost per life saved is not justifiable and so on, rather than the need to have to fight, as I said, through the airwaves and other means to have drugs made available. We had the ipilimumab crisis in terms of skin cancer some years ago. Orkambi is no different, and we can change the lives of these young people and their families. And as I said, if it's just down to pounds, shilling and pence, we can also remove some of the burden on the state, because if they're not treated with this drug, they will become a greater burden down the line. All politics is local, as Tip O'Neill famously said, and so I don't want to lose the opportunity, against a backdrop where we had a junior minister perpetrating a charade on the country, where he was seeking to have an additional cardio-catheterisation laboratory facility put in Waterford, where clinically there one isn't needed. There is one existing there, there is cardio care there, and at the same time there's a motorway to Dublin, there's good proximity to Cork, where there are many, many cardiologists. But in the northwest of the country, as has constantly been the case, and indeed I must give you the analogy of two maps I came across lately. One was from the road network from 1729, and it showed the road network, and one was for the motorway network in 2016. And you know what? They equally mirror one another. Indeed, many of our acute health services are the same. North of a line Dublin-Galway and west of Mullingar, or the Greater Dublin area for want of a better expression, we have no cardio-catheterisation laboratory facilities. If you have a heart attack in that part of the country, you are at a less, you have a less likelihood of survival than somebody who has a heart attack in Dublin, or indeed, as things stand, in Waterford. But yet we're taking up with that. Now, pre-election, the government announced that we were going to have a cardio-cat lab in Sligo to serve the northwest of the country. That was announced by government. Deputy Tony McLaughlin can outline this for you in case anybody has short memories. And we're very anxious to know when we will move to the position where tenders will take place and these services will be available, so that the people in the northwest of the country have the same possibility to survive as those equal citizens from other parts of the country as well. we've had an issue with follow-up mammography. Again, a pre-election promise. As you know, cancer services were stripped out of the North West in what, quite frankly, was a shameful act by a previous government. My own party, in fact, were in government at that time. It was a wrong decision then, and it is equally wrong today. A promise of follow-up mammography for those ladies who require it was promised pre-election, and now it seems what we're going to have is a truck visiting for 2 weeks per annum to facilitate those people, only those people who are already out of 5 years, thankfully clear from cancer. That's all that is going to come. In terms of other capital plans that again were announced, one going back to 2010 in terms of a new 90-bed facility at Sligo Regional Hospital, or now as it's called, Sligo University Hospital. I wonder how much the rebranding cost. Perhaps that money could have been better placed in upgrading the facilities that have been promised by government upon government over the years. There's a 90-bed facility that's somewhere in the mix. I'd very much like to see an update on that, and when can the people of the North West? That hospital serves a population of in the region of 280,000, and we're very interested to know when precisely that will be up and running. A new 21-bed facility in terms of the existing mental hospital. Currently there is a facility there where no matter what your complaint is, everybody's put together in wards. Totally, it's almost medieval in terms of its practice. There is a 21-bed facility, again, in the mix somewhere in the capital plan within the HSE. But rumours abound that the priority of this government is just the National Children's Hospital and that everything else will go on hold as a result. So we would like to get some clarification on that issue also. Very finally, can I ask, in connection with waiting list times throughout the country. I touched on the rheumatologist needs, specifically the need for more rheumatologist consultants to be appointed on the children's side. But on psychology and psychiatry, the waiting times for children with issues is beyond a joke. It is a couple of years in some instances. It's many, many months in others. I mean, this is simply far too long for people to have to wait. So I would appeal to you, Minister, while I appreciate it's the Health Miscellaneous Bill, which we will be supporting, but rather than waste the time that was before us here tonight, I felt that it was important that I would highlight some of the genuine needs of the North West of the country and indeed children throughout this country. And I would also ask that you would reminisce and embrace some of the pre-election promises for which the people of the North West of Ireland have waited far too long. Thank you.
Thank you, Deputy MacSharry, for that, I think, valuable contribution. Now, Deputy Louise O'Reilly, you have 30 minutes.